Secretary Robert F. Kennedy Jr. says he is removing the CDC's recommendation for children and healthy pregnant women to get the COVID-19 vaccine. And a new variant of the virus has made its way into the U.S. The strain is now being reported in at least 4 states, including California, Washington, Virginia, and the New York City area. Let's bring in Dr. William Schaffner. He's an infectious disease expert and professor of medicine at Vanderbilt University Medical Center. So, Doctor, I mentioned this new variant comes at a time when the FDA is also planning on limiting access to the COVID vaccine come the fall, demanding new trials. How significant is today's announcement about the removal of this recommendation for children and pregnant women?
Well, Lindsay, the removal of the recommendation for younger persons and pregnant women is a top-down recommendation. You know, normally we give recommendations to the CDC's Advisory Committee on Immunization Practices, and they then send that recommendation up through the CDC director to the secretary. And that system has worked very well for over 60 years. And so we're in a little bit of uncertain turf here about how recommendations are going to be made going into the future. Now, let me say quickly that the CDC's Advisory Committee is scheduled to meet in June, and actually their discussions in their previous meeting looked to me as though they were moving in an entirely similar direction. So at the moment, I think the availability of vaccines for younger persons and for pregnant women, just as the COVID summer surge is about to begin, is a little bit uncertain about whether insurers will pay for it.
Let's talk about COVID summer surge, the possibility of. Is that because of this new variant, or is that because in summers past we've also seen an uptick in cases? And what can you tell us about this new variant?
Yeah, it's for several summers before, we've had a summer, midsummer, late summer surge in addition to the winter surge. It's like a 2-hump camel that we have. This new variant appears to be a member of the Omicron family, just another cousin, if you will, to those Omicron variants that are going around. Does not appear to be more severe, is likely to be contagious, and the currently available vaccine is likely to continue to provide protection against severe disease. So that's very reassuring.
Okay, Dr. William Schaffner, thank you so much.
I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule. Last year, the Biden administration urged healthy children to get yet another COVID shot despite the lack of any clinical data to support the repeat booster strategy in children.
That ends today. It's common sense and it's good science.
There's no evidence healthy kids need it today, and most countries have stopped recommending it for children.
We're now one step closer to realizing President Trump's promise to make America healthy again.
Washington, where an explosive new report from a Senate Homeland Security Subcommittee has just been published. It accuses the federal government of failing to warn the American people and the world about potential side effects from the COVID-19 mRNA vaccine.
Literally, the job of the FDA, the job of the CDC, is to actually regulate our products and inform practitioners and people about the dangers that they might see as soon as they see them.
It was a job Dr. Jordan Vaughn says was not done, sounding alarm bells to lawmakers on Capitol Hill about a decision by public health officials in 2021 to not use what's known as a Health Alert Network message, or HAN, when increased risks from the COVID-19 vaccine became more clear.
That health alert notice would have told physicians, hey, be on the lookout for this because this is happening.
What was happening is the focus of an investigation by a Senate Homeland Security Subcommittee, which details in a brand new report how federal health agencies downplayed risks from the COVID-19 vaccine and failed to warn the American people, accusing the Biden administration of downplaying and delaying, warning the public about the risks of myocarditis associated with the mRNA COVID-19 vaccine. Cases of this inflammation of the heart muscle became especially prevalent in young men, aged 12 to 39 years old, according to the American Heart Association. The highest risk following the second dose of both the Pfizer and Moderna mRNA vaccines.
When we're talking about children or young men that have myocarditis, once cardiac muscle is destroyed, you're in for a long, hard life because you're not going to get new cardiac muscle.
Democrats on the committee do not support claims that public health officials knowingly kept information hidden from the public.
As we talk about the side effects of COVID vaccines, I think we need to be clear about the most important fact for all Americans. COVID-19 vaccines have saved millions and millions of lives.
This report released just one day after the new FDA commissioner changed the rules for COVID-19 vaccination booster shots, limiting access only to those over 65 years old or with underlying health conditions. In Washington, I'm Christine Frizzau.
The alert from most people, the COVID-19 vaccine had no side effects, but for some people, it actually did have some side effects, and they were long-lasting. Yale researchers just released these findings on a condition known as post-vaccination syndrome, or PVS. These are people who have had side effects to the COVID-19 vaccine. So to talk about this more, I'm here with family Dr. Nita Bajor to today.
Thank you for having me.
Let's first start with what the symptoms are of PVS. I think it's something I haven't heard of before. So what is post-vaccination syndrome?
So what we're finding is a group of symptoms that we're seeing in people that have received the vaccination. Symptoms can range from mild to severe. This is a new area of research, so as things are emerging, we're finding out, but mostly symptoms like fever, chills, some fatigue that lasts weeks to months to, long time, joint pain, diffuse joint pain, headaches, also some nausea, gastrointestinal symptoms, reasons, neurological symptoms like dizziness, hands and feet, and also myalgia, which is muscle tenderness and just muscle achiness. So we're realizing that these symptoms are not really fitting. It's challenging to diagnose because they don't really fit one clinical scenario, and of course we must exclude other medical conditions. Generally symptoms are mild. They're not life-threatening, but they can affect the quality of life. So,
have you seen patients with these symptoms?
Absolutely. I've seen patients, and several of our physicians have also experienced such symptoms because, this happened in a matter of months where people were dying, and a lot of us got COVID, but then the vaccinations were developed. So we're really trying to understand. But for the majority of the symptoms in the patients we're seeing, it's fatigue, joint pain, and neuropathy. I would say that's kind of the majority of symptoms.
Is it a certain age group? Are they older, younger, anybody?
I'm not saying, I don't know, whether it's any specific age group, but I would say some in conditions, people that have other chronic conditions. I think it links back to the immune system because vaccines challenge our immunity. So those of us that have a hyperimmune response,
that study, what did the study find?
So the study interestingly found that, it's not, although we kind of started looking at it because of the COVID vaccination, they realized that it could be linked to vaccinations like the flu vaccine, the hepatitis B vaccine. It showed that it's possibly linked to the lower white blood cells, immune system again, and higher levels of certain proteins in the patient system. And the other thing that we found is, although, it seems like there's a significant number of patients that are having these symptoms, on a global scale, when billions of people receive the vaccine, that percentage may not be that large in terms of global numbers, but still a growing body of research and, is needed to understand this.
So when someone is trying to decide, should I take a vaccine, how do they go about that process if they're thinking, hey, I had these long-term side effects from the COVID vaccine?
Yeah.
how do they go about that conversation of should I take a different vaccine?
Right. I think it's a really important conversation to have with your physician, with your provider. We are trying to understand the magnitude of these symptoms, the long-term complications and implications of these symptoms. So it's really a discussion to have, and it's more of a personalized approach, And for us as physicians, to be non-judgmental is really important, and to understand each patient's unique scenario and whether vaccination, it's all about risk versus benefit. So we have to make that educated decision with shared clinical decision making, because on a global level, vaccines, it's a public health tool, and it's very important to have safe and effective vaccinations. So when we find people are having symptoms after vaccinations, it's really important to have that discussion and keep an open dialogue as we learn more, as physicians get together and talk about it more as well. So,
all right. Well, thank you so much for joining us and covering that topic. I think it's something we haven't discussed very much before, so it's very interesting information.
Yeah, I think.
All right. Adam?
Shut up, bitch.
If you like this video, then like,